on 60 Minutes. What a mess.
At the age of 18, he looked like an old man with no teeth in him.
Our kids at risk.
I begged them not to take them out.
In the dentist chair.
You look in the mirror now, what do you see? A handsome young man?
Well, yes, obviously.
Check out the glossy magazines and you'll be dazzled by the Hollywood smiles. It's the kind of pressure parents and teenagers can do without, especially as the perfect smile costs around $5,000. And then there's the torture. It can mean losing a few teeth and months trapped in braces. But what if that traditional treatment was doing more harm than good? What if it was actually damaging your face? Well, that's at the centre of a bitter row in the world of orthodontics, where a group of mavericks are promising straight teeth and good looks without the extractions, and often without braces. These days, everybody wants that perfect smile. Getting it has become almost a rite of passage for teenagers, and a costly investment for parents. But now for the bad news. Maybe the treatment we've trusted for generations is all wrong.
There is no doubt that orthodontics can damage faces. All orthodontists know this. I've spoken to orthodontists who actually say to me, I've got to get these teeth straight. And all right, maybe it has damaged the face slightly, but, you know, that's the only way I can get the teeth straight.
English orthodontist Dr. John Mew is a maverick, dead against the popular treatment we take for granted, pulling out teeth and putting on braces. Sure, you'll have nice straight teeth, but, and here's the real revelation, often your face will actually end up looking less attractive. Have you damaged faces in the past?
Well, look at mine. My father treated me by taking 4 teeth up here and pulling everything back. And I've now got a very long face, very flat cheeks and a big nose. I might have been a good-looking chap.
This is a really good story. It's rather long, but you can go to this website and see the complete story. I do want to show another part of it. It feels important to point out.
Traditional orthodontics did that to his face.
They did, yes. Yes. If you look at Zoe, what's caused all this crowning is really not genetics. It's more related to the way she breathes. And if you open really wide there, Zoe, here you go. You can see that narrow top jaw, V-shaped arch.
Dr. Mahoney says the key is to diagnose the problem and start treatment at an early age. And the problem often starts here in the roof of the mouth. When children suck their thumbs or breathe through their mouths, it can be pushed in. And this narrowing can have a knock-on effect. The lower jaw is forced back and down, producing what most of us would call buck teeth.
We can treat as early as 6 and 7. The benefit of treating early is that we're working with growth, and as a result, we're making the space before the eruption of the teeth. So I think age is the most important factor that separates the new approach to orthodontics to the traditional approach.
Okay, just one more video.
Braces.
What were you told before you saw us?
I was told I need extractions and braces.
Ashley here avoided all that, and the proof is in the pearly whites.
Amazing. Yeah, I've gone from having a small, narrow mouth to a massive smile without extractions or braces.
Top of my breast back and bite together, lips closed. Very good.
Dr. Ari Masters is a dentist with a very different approach, curing overcrowding with this simple-looking mouthpiece, no braces, no extractions, and no surgery.
We found that if you spend time growing that upper jaw and often the lower jaw, results can be spectacular.
The no-brace technology developed in Australia involves physically expanding the size of the jaw to accommodate overcrowded teeth. You can physically change the shape of someone's face simply by guiding their teeth while they're growing.
You'll change the shape of someone's face either way. So I've had extractions and my jaw has collapsed and my upper lip is flattened, and the person who did that obviously didn't intend to do that.
They wear it 2 hours before they go to bed, must keep your lips together, and then all night.
And orthodontist Peter Hawkins
James and David Leaf have come to learn the technique for their own patients.
In theory, it's really quite simple, a bit like my demonstration blocks here. But the old way of doing it essentially involves grabbing your pliers, you pull a few teeth out, and use braces to stretch the rest around the jaw. This way, though, if you catch them early enough, you help the jaw itself to expand and make room for a nice, neat set of teeth. So easy. So why haven't we been doing this all along?
That's a good question, because Dr. Weston Price, who died in 1948, did a lot of fascinating research. He did a study on identical twins showing exactly what they're talking about. One 20 extracted 4 teeth and brought them back. The other 20 used a palate expander. And this shows the difference, the negative effects extracting the teeth had and the positive effects the palate expander had. If you had a palate expander, be glad your orthodontist probably knew what they were doing. It obviously reverses the damage of narrowing of the upper palate and widens the palate. So that's something to consider if you don't have a doctor who's versed in these newer methods. I'm going to show a couple more videos I think are quite interesting. This goes into a little more detail. Now I want to show this video. It's a doctor who did surgery to bring the upper jaw forward. One more video real quick of someone whose upper jaw was brought forward. You can see the dramatic effect it has to bring the upper jaw forward. If you can't find a doctor who's an orthotropist, this is a great website. It's about orthotropics. This is the doctor that was featured in the beginning of the 60 Minutes piece. He has the most advanced method where you don't need braces, you don't need surgery, And if you want to find one near you, here on his website you can do that. There are a lot of articles out there that are very important, a lot of websites, all sorts of information. This is a great article. It is talking about a study they did on monkeys where the oxygen was compromised and how they developed malocclusions, various dental problems and jaw deformities. This is interesting too. They were talking about treating children as young as 5. This kid had ADHD, behavioral sleep problems. They gave him a palate expander, took out his tonsils, and all of his health issues and problems were taken care of. One thing that people don't realize a lot of times is that a lot of these problems are due, like I showed you in the second part of the 60 Minutes video, to breathing from allergies or illness. Many articles have been written about this, the effects it has, what to do. These are some really good articles. I often had strep throat. Not only can it affect your breathing, but it's a very dangerous thing to not take care of in a child because it can lead to severe health problems, not just from breathing, but just also vital organs can be easily damaged if not treated correctly. Sleep TV is a great place to go, learn all about these things. They have a lot of great little pieces. This is about
Evans from Sleep Better TV, and I'm very fortunate to be with Dr. Larry Wolford.
This is Dr. Larry Wolford. This is the piece talking about all the various professions that should come together to see how they relate in treatment, from orthodontists, chiropractors, sleep doctors, what have you. He's been doing this for a long time, realizing the relationship of the jaws and to bring them forward, and he's one of the pioneers in that idea. And here's Sleep TV talking about what we've been talking about.
My guest is Dr. Larry Tribble with the Center for TMJ and Sleep Apnea in Independence, Missouri. In this segment, we're discussing the merits of the ALF appliance, the Advanced Lightwire Functional Appliances, and BioBlock Orthotropics. Dr. Tribble, are there orthodontic procedures or appliances that work well with helping to establish a healthier airway for children?
Yes, Scott.
And that's more of the same of what I'm telling you. Also, I looked the Bureau of Labor Statistics, highest paying occupations, oral maxillofacial surgeons, and then down the list, orthodontists, which, I have health insurance. I can't afford to have a filling, so I know more information than these doctors. I hope that you all, are careful about who you choose. This woman right here has videos explaining her, what she's gone through with orthodontics. I've pointed out some things I find very important, that just a list of what people should do and know and what I've been through. See, this is a great website too, Face Focused. You should play that to understand exactly what you should look for in a doctor. And let's see, I'd like to show some of this is from my teeth being removed in '81 when I was a kid. The 4 teeth removed. It says routine. Here's what I looked like before orthodontics, and this is what my daughter looked like. As you see, we have very different looks. This is us in our kindergarten pictures. That's me and that's her, but we ended up, obviously having similar facial features. And anybody can get the right help they need. You just have to find the right doctor. As you see, this is just some briefings of mine, what they did, what they shouldn't have done. So try to find an orthotropist, doctors who show the teeth and the face. As you see, this cute girl right here had orthotropics. Look at how well it turned out. Age 11 to 34. So do yourself a favor, research, find what you can, and make it happen. Good luck, and I will be doing another video talking about the negative effects and what you can do. Thank you.